So what does this liver function test report actually contain? Why wait for a doctor to explain when you can understand your own liver function test? Today, I'm giving you the ultimate cheat code to understand your LFT report. Hey everyone, I'm Dr. Bhargav Raut, the Chief Pathologist at PathoFast Lab Pune, and I've tested thousands of liver function tests. And trust me, I get so many messages from patients saying my liver function test is high, my SGOT is high, my bilirubin is high. What does this mean? But today I'm going to simplify it in just one step. First, our liver enzymes SGOT and SGPT. These enzymes live inside your liver cells, and their normal levels are generally less than 40. If your liver is damaged for any reason, the enzymes leak out from the liver into the blood. The more the damage, the more the enzyme levels in the blood. Now, let's understand what different enzyme levels mean. You might have heard about fat getting deposited in the liver or fatty liver, or people who are on taking medications for many years. In all these kinds of people, the levels of SGOT or SGPT may rise up to 2 times of the normal, which means they will be around 80 to 100. This is called mild inflammation and it is usually reversible. But if these enzyme levels are even up to 5 times elevated, that means almost more than 200, then it means there is more serious damage, and this is usually caused by viral infections like hepatitis A, B, C, D or E, as well as drinking too much. If the levels are 10 times above normal, then that is a very serious condition indeed. For example, if your levels are above 400 or 500 or higher, this can be a medical emergency and you should get yourself consulted with a doctor immediately. The usual causes of this include overdose of a certain medication or even a blockage of the blood supply going to your liver. One important thing to remember is that the SGOT or AST level can also come because of damage to the heart, and if the SGOT or AST level has gone up together with some kind of heart problems like chest pain or more, you should also get yourself evaluated from a cardiologist or a heart doctor. The SGPT or ALT level, that is almost completely specific to the liver. Only when the liver is damaged does this level go up, and so any elevation in this is indicative of definitely some problem either in your liver or your gallbladder or gallstones. The second important group of tests are the bilirubin tests. Total bilirubin, whose normal range is usually less than 1.2, comes from old broken down blood cells. This total bilirubin has 2 important subtypes which will also be mentioned in your report. Let me explain what each of them means. When old red blood cells break down, they release a form of bilirubin into the bloodstream which we call indirect or unconjugated bilirubin. This will be mentioned in your report. The job of the liver is to take this indirect bilirubin which has been broken down from the red cells and convert it into direct or conjugated bilirubin. This direct or conjugated bilirubin now flows into your bile ducts from your liver and from there into your intestine. It is also responsible for giving the yellow color to the urine. If your direct bilirubin level is high, it means a blockage of the bile ducts. This can be because of many different causes, including gallstones which are blocking the bile duct. It could also be a cancer which is pressing down onto the bile duct and blocking it. On the other hand, if your indirect or unconjugated bilirubin is high, it means that there are too many red cells being broken down. This can happen in a variety of causes, like for example some types of anemias. It can also happen if you have malaria and many other conditions of the spleen. So how will you know whether your total bilirubin level has gone up or not? Well, usually when the total bilirubin value goes above 3, your eyes are going to become yellow. The white of your eyes will become yellow, your urine may also become dark yellow, and this is called jaundice. The third group of tests are the proteins. In this, the important one is albumin, the same thing that you find in egg whites, and its normal range is between 3.5 to 5. The liver makes this protein every single day. Albumin is important because it gives your blood the volume or the quantity or the amount. If the albumin levels reduce, you will develop swelling all over your body. It also prevents fluid from leaking out of the cells. When this albumin level goes below 3, it indicates that the liver is not working properly. Chronic liver disease conditions like cirrhosis, long-term abuse from drinking too much, hepatitis B and hepatitis C can all cause destruction of the liver, and all this will eventually cause low or poor protein production and low levels of albumin, and that is why the albumin level is mentioned in your report, and it is very important. Very low albumin levels below 2 will cause severe severe swelling all over your legs and all over your stomach. This is called edema and it is a dangerous condition. Together with albumin, there is another protein called globulins, and the only job of the globulins is to fight against infections, and their normal level is usually between 2 to 3.5. If the globulin level goes above 4, it means that your immune system is overreacting. There is some kind of a chronic inflammation or swelling or infection, or even an autoimmune liver condition in which the body attacks the liver itself, and that is why it is making more globulins. On the other hand, low globulin levels, for example if it is less than 2, would indicate that the body's immune system is not working properly, and this can be the case in those who are weak in immunity or whose immunity is deficient. Next is the GGT enzyme. GGT stands for gamma glutamyl transferase, and it is very sensitive to liver damage due to drinking too much. A normal level of GGT is usually below 60. If the GGT is 2 to 3 times above its normal value, it basically will indicate that there is regular excessive drinking taking place, or also seen in those who are overweight and have fatty liver. Even small amounts of liver damage can raise the GGT level, and so it is very sensitive test. GGT levels of 5 to 10 times above normal are a very serious condition, and it usually means that there is a problem in the bile duct. The bile duct is not allowing the bile to flow out normally, and this is causing damage to the liver by back pressure. And if the GGT is more than 10 times normal, it means severe bile duct damage or even cirrhosis of the liver, which is basically a condition in which your liver becomes completely fibrosed. This is a medical emergency and must be handled immediately. The last but not the least important is an enzyme called alkaline phosphatase. It is found in the liver, in the bones, and a few other tissues in our body. Its normal level is usually between 30 to 120 units. If the level is up to 2 to 3 times above normal, there could be a problem either in your liver, in the bile duct system, or even in your bones. This is especially important in older men, and it needs more tests to be investigating what is exactly the cause. If the ALP level is 5 to 10 times above normal, it usually means that there is some significant problem in the bile duct. Gallstones or even some kind of a cancer which is pressing down onto the bile duct could be the cause of this, and it has to be investigated further. Finally, if the alkaline phosphatase level is up to 10 times above normal, it means that the bile duct could be completely obstructed, and this needs emergency medical attention. So you now have a general overview of what your liver function test means, what it means if different enzymes are elevated, and how much should they be elevated, and what does that correlate with. Whatever it may be, always remember, please discuss your report with your gastroenterologist or hepatologist or your nearby family physician before taking any further action. Thank you. If you are in Pune city and you need a liver function test with home visit for sample collection, do call us at Pathofast Lab Pune. We provide liver function test reports on the same day, and our reports are extremely reliable and delivered to you by WhatsApp as well as email. I verify each report personally, and I am well versed in interpreting different kinds of liver function test reports.